stand on the right side of the patient, okay? Because do that right at the start, otherwise you forget it. When you know your exam, at the end of the exam, you say, hey, where are you standing? Just look at you. Then you know, at that time you are very nervous. You think, oh my God, I have spoiled the exam. Now I am going to fail. That type of feeling comes and you cannot speak anything. So don't do that, okay? Stand on the right side. So which is the right side of this patient? Okay, this is the right side, right? See this? This is sleeping like this, so this is the right side. So I am standing on the correct one. Now second one is you have to introduce yourself to the patient. You understand? So introduce yourself means tell your name to the patient. Okay? And third is take permission from the patient. Permission means simply ask, can I examine you? Today is my boss exam. Can I examine you? Done. Okay? All these things carries the marks. Don't forget it. Now, after that, we'll ask general information of the patient, right? What is the name? What is the age? What is the occupation? Where is the address? And regarding the gender, you can ask, or you can simply look at the patient and you know which gender is there, right? So these are the very basic things. And trust me, some of the students forget about this in the exam. Because they are so much nervous. They don't know what they do there, you know, that type of environment. There are 5 examiners in front of you, 5, 2 internal, 3 external examiner will be there. And the environment is like that. So student may get nervous. Okay, so don't get nervous. We are there to help you. Actually, okay, both me and Ravi sir will be there. Maybe Vikas sir may come and join, 3 externals will be there. You don't need to worry at all. Okay. Now, after that, okay, this much is common in all patients. Okay, everyone. Now we'll ask, okay, percuss the chest and show me. So how to do that now? Share. So when you percuss the chest, actually the best position for the patient is sit on the bed or sit on the chair. Okay? Or sometimes what you do is you finish the anterior part of the chest, lateral part of the chest on lying down position, and when you do on the back side, you ask the patient to sit. That is also okay. Is it clear? Yes. Now you start from the, see this area. This is called supraclavicular area, isn't it? This area, right? This area. So how to percuss and how to do percussion. See there. I'll show you first. For example, I am a right-handed person. This is my left hand. Okay, I'll put left hand like this here. Okay, these fingers should be spread. Okay, and this is my right hand. See this? How am I moving the hand? See this? Only my wrist is moved, right? It is like this. Do not move the elbow. Do not move the shoulder. This looks scary, isn't it? So just move the wrist and hit on the middle phalanx of the middle finger, right here. Okay, with your middle finger. See this? And do not continuously hit like this. Okay, it is also not good. Just hit 2 times, enough. Maybe maximum 3 times, but 2 times. If you see a very standard, video, they just hit 2 times, like this. See? Okay, this is the way. Now let's do it correctly. We'll start from here. And always compare on the other side. Always. Okay? Over the clavicle, you just tap it. You don't need to do anything. Just simply tap the clavicle. Because there's a flap, a little bit thicker, so the sound is a little bit different here. Okay? Tap the clavicle directly. Done? Now what we do after that, we'll percuss in some other area, like this here. I'll do it here. Immediately compare it. Okay, done. Now here. Now you do on the axilla. Like this, you have to do the anterior part of the chest. Any question till here?
Yes.
Can you handle this much? Yes. Now another question we may ask you, how do you find the upper border of the liver? Isn't it? This is an important question in surgery also. So where is the liver? Liver is always present on the right side, okay? Right side in the right hypochondrium. So how to find the upper border of the liver? I need to do percussion again. But where do I percuss? See this? This is clavicle. You find the mid-clavicular line. Okay, mid-clavicular line. For example, this is a mid-clavicular line. So what I do, I'll percuss from here and go slowly downward. See this? Okay, this is dummy, but still, they have made it like this. So when I reach the upper border of the liver, this percussion note changes, because here is the lung. So what is the percussion note over the lung? What is the normal percussion note over the lung? It's resonant. It is called resonant. Okay. When I reach the liver is a solid organ, so the percussion note changes. It will change to dull. So you note that area, and you say from here the upper border of the liver starts. Done. Now you continue to do. And reach the lower border of the liver. Now when you reach the lower border of the liver, from that point, downwards, again the percussion note changes. It will become resonant once again, which we call it tympanitic. So why? Now the dull note, why it changes to resonant again? Why? What is there inside the abdomen? Intestine. Very good. Inside the intestine there is gas.
Yes.
Okay. So when you percuss over the gas, again it will become resonant. So you mark these two areas, 1 and 2. This is called liver span. Okay, liver span. This is very important question. Teacher may ask you. Okay. So this is how a percussion is done. Now, if I want to do on the back side, always remember one thing. Okay, you ask the patient to fold the hands like this. This is very important step, and you should not forget. Why? Why we do that? There is a reason. Why? Because scapula will move, away from each other, and there is a space which is created to do the percussion. Okay, so bone will move away from each other, right? So those areas will percuss, and slowly it's also the same thing. We'll start, on the suprascapular area, then interscapular area, then infrascapular area. We reach the base of the lung. This is how percussion is done. So you need to do a little bit more practice. Okay. Now, how auscultation is done? Because we are here, so I want to show you that also. How auscultation is done. First thing is how to put stethoscope on your ear. That's also important question asked by some of the teacher. Okay. Now, I'm sure that is quite a basic thing. Every student know that. Okay. So how to do auscultation? Same thing, same like percussion. You start from the supraclavicular area and ask the patient to take deep breath, and always compare on the both sides. If you do it here, you have to come here. If you do here, you have to go there. If you do here, you have to come here. Okay? Here, you have to go to the axilla. Like this, you compare all the other areas on the anterior and lateral part of the chest. And again, ask the patient to sit and do on the back side. Same thing, suprascapular area, interscapular area, infrascapular area, and base of the lung. This is how auscultation is done. Okay? If you want to demonstrate on a real patient, you can do that later. But this is how the first thing is how you do it. This is important.